in May, I should say, I kind of went to her and I was like, I'm really burnt out from this role. Like I told her, I'm like, I can't continue working right now, like full time. Like I can't, like I've had too much burnout from this last month or for this last year. And so luckily then she spoke with her superiors and HR, and they were able to offer me a new role in a part-time capacity. So it was nice because it was a new role that much better fit as a programs coordinator, working with programs, more my jam, but also giving me that part-time that I wanted to de-stress a little, but also concentrate on my business, because that was another factor, is that after the year of not really being happy in that role, I kind of was like, okay, what do I want to do? And that's when I wanted to really take my consulting seriously.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 71. Hi everyone, Omari Richards here. Thank you all so much for joining me today. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe to this podcast, to leave a review, to share with a friend, and to leave a like if you're on YouTube. Greatly appreciate that and help the show get out to more people. If you want to support, you can buy me a coffee.com/PH Millennial. And don't forget to subscribe to my email list. I try to get bi-weekly emails out to you all with some good information about jobs, internships, fellowships, and just some other thoughts that I have sometimes. So check that out. I enjoyed today's episode a lot. Get to have a conversation with someone with both their Masters of Public Health as well as their Masters of Business Administration. So that MBA MPH combination is a good thing to have. And one other thing that I really enjoyed about this interview I wanted to highlight here is that she shifted from a full-time position into a part-time position in her nonprofit job. And I think that's also something that you don't hear a lot about people talking about. And that's what we're going to be talking about this week. And then next week's guest is actually someone that has done that same thing, shifting from full-time to part-time in local public health. So be sure to listen to that episode as well as this. And I hope you all enjoy. Today, we have a passionate public health consultant with experience in program management in the nonprofit sector. She got her Bachelors of Arts in Anthropology and Applied Statistics at Indiana University of Pennsylvania. She then went on to get her Master of Business Administration at Ashford University, then went on to get her Masters of Public Health at the University of Pittsburgh. She's the owner of a business, Tabitha Reefer Consulting, where they specialize in grant writing, writing services, program evaluation, program coordination, professional workshops, and curriculum development. She also works as a part-time program coordinator at Jacobs and Cushman San Diego Food Bank. Be sure to follow her on Instagram at Tabby Reefer. We have Tabitha Reefer, MBA MPH CPHC Chess. Welcome to the show.
Thank you. Happy to be here.
I'm really glad to have you on the show. And as always, just glad to tell another public health story. And yours is unique, I think, in a lot of ways. So I'm looking forward to it for sure.
Awesome.
So how are you doing and how you been coping during the pandemic?
I've been pretty well. Obviously, like everyone, I'm over COVID, but still being careful and taking all the precautions, and pretty fortunate that everyone I'm in contact with is vaccinated. So it's kind of a relief. So that's nice. I feel like being in the nonprofit world, COVID has been a stressful time, but it's also kind of been exciting, which is terrible to say. But I've been working in food banks for 5 years now, and so it's a lot of activation. So it's kind of nice to get out of the usual stagnation and feel like you're actually really doing something and helping out. So for me, it's been actually exciting. When it first hit, my husband actually said something like that. We were talking about it. He's like, COVID like activated you. And I'm like, yeah, I feel like it did, like put more urgency into the work, and we were able to reach people that we typically wouldn't have reached other times. So yeah. How about you?
Yeah, well, absolutely. First, I want to say like that is so true. And food banks have been dealing with a lot during this time because
Yeah.
especially with food insecurity and then
Hmm.
people not being in school, so children weren't able to get a lot of meals that
Yeah.
they would typically get. So
Hmm.
thank you for the work that you're doing. I'm glad that you felt like energized by it and whatnot. So thank you for that. I've been doing well for the most part. You know, thought things were going to get better, but then they kind of like got back at where they they were at the
Yeah.
worst.
Yeah.
So same as you, taking the same precautions, just trying to get outside and find some
Hmm.
sort of routine that works for me in this world that is probably going to be this sort of way for a while now. So I think it's an adjustment for all of us. That's for sure.
Definitely.
Yeah. So tell me, how do you identify and then tell us a little bit about your personal background?
Yeah. So I identify she, her, hers. And just personal background. I grew up in a small town about an hour north of Pittsburgh, Pennsylvania. Um, and I've stayed local throughout most of my educational career and um, as well as my professional career at first. I went to Indiana University of Pennsylvania, which was only about a half hour from my home. I did my MBA online, and then went to the University of Pittsburgh, so again close to home. I did like a semester at George Washington University actually for my MPH, but just didn't feel like I fit in there, so that's when I ended up transferring to Pitt, and was very happy there. I took me a little bit of time after my MPH to find a job. I moved to Hawaii with my husband because he was stationed in the Marines there. And that's actually where I started my consulting business, which we can talk about more later. But so even though it was kind of stressful for me not working because I'm a workaholic, with balance. But I've always been that person who usually worked multiple jobs, even all through college and graduate school. And so it was really hard for me there not having a full-time thing, but my consulting was great. And then we moved back home to Pittsburgh for a few years. And then now we're in sunny San Diego.
Yeah, okay, that's awesome. That's awesome. Thank you for sharing a little bit about your background there. And yeah, sunny San Diego is a beautiful place to be. I can only imagine. I
Yeah.
hope that you're able to enjoy the weather and this long
Yeah.
weekend as well.
Yes.
Um, and I will dive into some of those things that you did mention there. I
Yeah.
wrote them down so that I can remember to bring it up when it becomes relevant, I guess.
Yeah.
So what does public health mean to you?
For me, public health just means like health, good health for all of us. And so ensuring there's equal access, everything's equitable, being mindful of others' health too, I think is important because you and I could have the exact same experiences, but both of us handle things different ways. And so being mindful of that and just not your own personal bubble. So, things I do affect you and vice versa. So um, it's kind of just broad picture what it means to me.
Yeah, and it's interesting you say that things that affect you affect me because a lot of people are not taking that sentiment
Yeah.
with wearing masks
Yeah.
or getting
Yeah.
vaccinated or anything like that. But I
Hmm.
think it is very essential to the public health philosophy of
Hmm.
okay, let's do better to help the population more so than what is important for myself. Um,
Exactly.
but yeah, here we stand in a very weird time.
Yeah. And I think maybe that's why I feel like with that question can also mean different things throughout the career. Maybe I wouldn't have answered it that way 2 years ago, but now through the pandemic, it kind of makes you think differently.
Yeah, absolutely. And I like that because I think it's important to not be stagnant in our
Hmm.
definitions or how we view
Yeah.
things because this world is not static and we should not be static. We should be always growing and learning and changing our perspectives with new experiences and whatnot. Um,
Yeah.
so before we get into your story, I wanted you to link the LinkedIn group that you shared with me.
Yeah.
And just so people familiar of how we met at one of the public health happy hours. So you should definitely attend those.
Definitely.
First and foremost, because I think it's just a great place to connect and
Hmm.
meet new people. And I've met Tabitha, who's on the other side of the country, but loves public health, and we're able to connect, and I'm looking forward to telling more of the story. So yeah, so tell me a little bit more about your public health LinkedIn group.
Yeah, so I had a really great community with professionals back home in Pennsylvania. I grew up there, I went to school there, worked there, so I had a great network. But when I moved to San Diego, my husband and I just knew each other. We moved out here because my husband's in graduate school for physical therapy out here. We just knew each other, and I found some great friends personally, but I was really craving that professional connection. And so I actually just cold LinkedIn someone on LinkedIn, and just essentially it was someone who was from the East Coast though, and that was out here, and kind of told her, hey, I'm trying to make a network, blah blah blah, can I talk with you, because she also does consulting, so I wanted to talk to her about that too. And as we were talking, we talked about there's this gap of a place where public health professionals can come together. And after I got the phone, I was like, I'm making a LinkedIn group. And so I started the San Diego, it's really I feel like it's really wordy, but it's the San Diego Public Health Professionals Networking Group. That's the title on LinkedIn if you want to search. Or I guess in the show notes, link it. So I started it early this year. And I did make it location based, just because the point of it is, to get people together, hopefully, learn, grow, job opportunities. I'm starting to do monthly meetups, which have been a slow process, but I'm hoping to see it build more. I reached out to the public health schools locally also to promote it, because it'll be great for students to get into the community as well. And so I would like to see, as it grows, it, including volunteer opportunities, maybe some educational things, once there's, more chatter in it, more that. But I think it has potential, and I think there's a need. And like I said, just a good way to people to connect in the area. I'm not limiting it to just MPHs too. I have some social workers in there, and as well, people who do more of research. So it's public health, as public health is broad anyway, keeping that group still kind of broad within health professionals. So kind of how you see yourself.
Yeah, absolutely. I love that you did that. It was very public health of you to see that there was a need and try to fill that gap.
Yeah.
but definitely necessary. And I think as public health schools, especially public health schools, because one thing that I feel like we don't get in public health schools, enough interaction with professionals or young professionals in public health to really get that informal learning and understanding of what it takes to be an actual professional in public health, or what all of those different things can encompass. So I think it's hugely important that you are doing that. And I definitely think there is probably a big public health community that you're going to find in San Diego as you continue to build it. So I look forward to that as well. Yeah. And then jumping into your story now. So you got your Bachelors of Arts in Anthropology and Applied Statistics at Indiana University of Pennsylvania, which you said was 30 minutes away from your home, if I remember correctly.
Yeah.
So tell me the thought process for going to the school and getting this degree.
Yeah, so going to the school close by, didn't have to pay for room and board because I just lived at home. So obviously that was a huge factor. But it is actually a really good state school in Pennsylvania. It's I think it's actually the largest, besides the Pitt and Penn states, but the smaller universities, I think it's the largest. Pretty sure it is the largest. So it just made sense. I actually started as a history pre-law major. During my first full-time semester. I actually took 2 classes there during my senior year of high school. So that was nice to kind of get my feet wet into the university world. And during that summer, I had another class scheduled, and the school switched me to an anthropology class to meet 2 different requirements, whatever. And within a month, I switched my major to anthropology. And I don't know what now looking back, I don't really know what exactly made me to change, but I know in 2008, the recession, and I remember seeing this news story about these law school graduates that couldn't find jobs, couldn't pay off their loans, all these things. And I think it kind of scared me into being like, oh my gosh, I can't be a lawyer. Look at all this stuff. But then I changed it to anthropology, which is like, what? So yeah, that probably didn't really make it any better, but whatever. That's what I did. I just kind of like public health. I liked how anthropology was so broad. I was like, oh, there's so many different things you can do. And I didn't even know what anthropology was when I started taking the class. And then like I said, like 4 weeks later, I switched my major to it. But from that path, then I got placed with an advisor who actually had a focus on health, specifically maternal and child health. And so he kind of like geared me into the public health realm. And so yeah, that's kind of how I ended up with the health focus, is thanks to Dr. Krukman. He was a great advisor and yeah, really kind of steered me in the right direction. And I also actually ended up being good at math. Never thought I was good at math, like all through high school, until I got to like trig, which was the weirdest thing. Once I hit like trig, it all made sense to me. So I ended up with my interest in health. I actually was going to go for epidemiology. And so I decided to do my minor in statistics. And so that's why I went with that route too, because it went well together. So yeah, I did 2 internships while I was in my undergrad with the Pittsburgh AIDS Taskforce, which was really great. And also kind of, again, got my toes wet in public health. It was very learning. Everything was just a learning experience for me, I think, because I was the first person like in my close family to go to college for a bachelor degree. And so I feel like I was a lot of just trying to figure out the system and like what I was going to do. Yeah, just a big learning experience for everything. But it's led me down this path now, which is good.
Yeah, and congratulations to you on that's huge. So tell me more about that, as being the first person to go to school as in your family, and going to university in your family.
I feel like, and it's funny because it was still always expected. So even though not anyone else in my family had, I'm the youngest of like the generation of cousins. And so it was just always expected, like, you're gonna go to college, like just because we didn't doesn't mean you won't, times changed. And so I think I'm thankful for my parents for letting me like live at home, things like that, because my parents wanted me to do that to save money because they knew it would be a big expense. So I'm glad that I did that. I actually don't like regret like not living in a dorm or anything like that. Like I have no regrets about that. But I think it was just a lot of the figuring out what I wanted to do. I think was hard just because I feel like I still don't know what I want to do. But and I think that was kind of sometimes the most difficult part, just because there wasn't anyone that I could talk to older than me that I was close with, that I could talk those things through. So I'm like always the annoying cousin now that's like trying to like make sure everyone else is making a good decision, because I didn't have that to navigate. So
okay, well, I can imagine that your family and your cousins are very proud of you. Probably your cousins probably look up to you a lot. So and you've done a lot of amazing things since your bachelor's, which we're going to talk about as well. Tell me, you said you were in the Pittsburgh AIDS Taskforce during undergrad. How did you get involved in that, and then what did you do?
Yeah, so whenever I decided I wanted to go into like public health, I just started looking at different organizations and to intern with. And I read I can't even remember the title of the book now, but I did like a whole paper on it, but it was about HIV and AIDS in Brazil. And so I ended up just finding Pittsburgh AIDS Task Force, just looking through different organizations that I could internship with, and just cold emailed them. And there wasn't like any official application process that so many places have now. So I cold emailed the director, ended up meeting with the program director, and we hit it off right away. And it was in the prevention division. So the first year was a little, intern work, like I updated the resource manual. I also went on a few like educational things. So I went on one, there were some older interns there that were doing health, like safe sex 101 at senior high rises. And so I went with them on one of their education things. And I was like, oh, this is really cool. Like teaching, the old people about condom use and things like that. But it was fun. They were older adults, were very engaged, and you can imagine the side conversations that were happening. And then my second year, though, I got a little bit more responsibility and actually planned their annual health fair. So found the people to attend, found volunteers through the one medical institute, Stanford Brown, to come do blood pressure screenings, other screenings like that. So that was nice because I felt like that was my first time I really had like that kind of responsibility, which was kind of intimidating, but really fun. Really, I remember being so stressed out, but it went off really well. So I did that my summer between my sophomore and junior, and then junior and senior year. And then still in contact with my supervisor from that, actually still.
That's awesome. Yeah, I think it just goes to say, like, you found out about this public health field and you're like, all right, what kind of organizations are there? What kind of stuff is there? And then, like you said, you read this book about HIV and AIDS in Brazil, and then that kind of led you to the AIDS Taskforce. And so I just like that you're like being proactive and saying, okay, I want to learn more about this thing that I think I like. So I think that's great advice and insights for any students out there might be looking for opportunities to learn and get more involved. So I appreciate you sharing that.
And I think it helped too, like solidify, because like it was one summer. Like if I figured I didn't like it, I didn't have to do it again. So it was kind of nice to just get my feet wet. And I actually was also introduced to like food pantries the first time through there too, because they had a food pantry, and a couple times I like worked it for them. And so it was interesting now looking back that now I've been in food banking for 5 years, and I actually kind of started getting connected with that back then, not knowing that I was going to end up doing that.
yeah, life, right?
Yeah.
Awesome. Were there any other takeaways from your undergrad that you wanted to share before we move on to the next part of your journey?
I just think it's I don't know, when I look back now, I feel like people are like smarter now. I don't know, or just they have more access to things. Like, so like this podcast is great, but there's so many great people on Instagram and that talking about public health and different career choices. And it's not really a takeaway, but just something like I've been observing as a adult that was, millennials, we grew up with the age of internet, but social media wasn't the same whenever I was an undergrad or even graduate school than it is now. And so I feel like there's so much at your fingertips now that you can learn from and help you make career decisions. And so I'm a little envious of the younger people who kind of get to learn from us.
Yeah, I absolutely agree with that. I feel like going into public health, even when I went into my MBA, just kind of like a black hole, you kind of just diving into and trying to figure things out.
Yeah.
And,
exactly.
and as you said, like now there's this podcast, there's a couple other podcasts out there, and then like a whole host of people on Instagram talking about public health, and there's people like who are just easily accessible to know more about public health.
Exactly. Yeah.
Okay. So you graduated, and then what was the thought process for going on and getting your master's of business administration at Ashford University?
So I knew I wanted to get my MBA when I was in undergrad. And it's because,
okay, sorry.
Yeah. Oh no, you're fine. Yeah. Because when I was looking through public health, like the curriculums, they were obviously super interesting, but I knew like there wasn't anything from a business side. And my thought whenever I got my MPH is that I wanted to, maybe run a nonprofit or something one day. And I'm like, well, I'm not going to have any business knowledge to be able to do that. So I knew that was why I thought about getting my MBA. And I did healthcare administration just because it was the closest thing, for the public health field. Also opened my door of like, maybe I want to work in a hospital setting or something. So I wish that your MPH program did include something like some kind of businessy things like that, especially with consulting getting so bigger. So my plan though originally was to do my MPH first and then do my MBA. but I really wanted to go to Pitt and stay close to home. And I didn't get in there the first or second time that I applied. And so I almost went to Drexel that like the first year after my bachelor's. But when I visited the program, it just didn't feel like a good fit for me. At the time, I was going to do infectious disease epidemiology. Like I was like, wanted to do epi, and I was like they weren't super about infectious disease back then. And I don't know if they have changed now, but I know at the time it was a lot with autism, mental health, which is great, but just wasn't my niche. And I was looking for online MBA programs and found Ashford. And on top of that, I found out that I could double up on classes and complete it in a year. So that timeline let me then then be able to start an MPH program the next fall. So I focused on that for the year, which worked out well because at the time I was waitressing full time and it was easy to fit like my classes into my life. And I enjoyed the classes, and I feel like I still kind of use like what I've learned there. It talks a lot about employee retention and accounting. And I feel like for my business and also just for my work at the food bank, maybe I don't work exactly with employee retention, but I've worked with volunteers, I've worked with partner agencies, so just places to retain them. So, and it's funny because I get asked a lot about my MBA, like more so than my MPH when I do interviews.
Yeah, because I don't know. I feel like it could go both ways, but it is interesting that they do ask about the MBA more.
Mm-hmm. Yeah.
I guess looking back on it now, you said that you were hoping to do the MBA because you felt like MPHs, which I do agree to a very high degree, that they don't offer a lot of the business side of things. Do you feel like you gained a lot of what you were trying to get?
I did. Yeah, I did. I felt like I gained a lot of knowledge and it was interesting to me, and it helped, just helped me look from a business side more, kind of seeing the whole picture. Because I know sometimes with public health, we get very like focused and in our holes. And so it kind of helped me to step back and see, well, how does this affect us from a structural standpoint? And why are these decisions being made?
Okay, so you said during your MBA, you were a full-time waitress.
Mm-hmm.
And then I think you were also an auxiliary assistant at Butler Memorial Hospital.
Yeah, I started that January 2014. So I actually started that during my MPH. So when I was doing my MBA, I was waitressing full time, and then I was also house sitting, and that was my other thing.
Okay, awesome. Well, I'll ask you about the auxiliary assistant in a bit.
Yeah.
So were there any other takeaways that you wanted to share about your MBA experience?
Not really, but I think it's a good route for people who again want to have that business side of it. One of the consultant public health professionals out here that I've met through my group, she actually did just finish her MBA. So she's had her MPH for a few years and now decided to go back for her MBA because of that reason as well. Just looking at it from like a management perspective, being able to have work of that kind of knowledge. So I feel like it's a need that a lot of people do recognize as they've gotten around, but it's obviously money, which is a commitment too. But it's just a good way to get more of those kind of skills.
Okay, awesome. Okay, so you got your MBA, you graduated. You said earlier that you got rejected from getting into your MPH at the University of Pittsburgh twice.
Yeah.
So tell me, so I'm guessing that you applied the third time.
So the failure of Tabitha Reefer. I applied for fall 2012 at Pitt, didn't get in, applied for fall 2013, didn't get in, and I got in at George Washington University in DC. And so I got in for epi there, and I went there. And I just didn't, it wasn't just a good fit for me. I feel like I've grown a lot since then, since I was in my early 20s then, but like, I don't know. It was just a whole group of people that like, I just wasn't used to being around. I'm like from a blue collar place. Pittsburgh's a blue collar place. And I'm like thrown into like this white collar DC where everyone are like, I remember walking to class one day and someone was like, yeah, my parents, like, they don't want me to work, so they're paying for everything. And I'm like, what? So I was like miserable. And so I applied to Pitt again. And at this point I was like, and then actually, so I should go back, sorry, is when I was there and I was like really taking my FD classes, I started being like, it was too like disconnected for me almost. I loved epi, but at the same time, I wanted to work where like I could see an impact more of my work. And I just felt like epi wasn't it. I felt like I was just going to be trapped in a desk and not talking to anyone all the time, which I know isn't always the case, but I wanted to be more hands-on in my community. And so I actually decided that I wanted to switch to community health. And so I reapplied to Pitt for the spring semester of January 2014 and actually switched my concentration to behavioral and community health science, and then got in that route. So that was my third time. It was a charm for me. And luckily it worked out because I wasn't going back to DC. I was like, I gotta go into Pitt, gotta get into Pitt. And I was fortunate that my classes transferred over. So although I was out money for my apartment that I had down there, I didn't have to retake any classes, which was really nice. So yeah, that was I can't remember exactly the original question, but that's kind of how I went from DC then back my third time.
Yeah, and I think that makes a lot of sense. And thank you for clarifying the going to George Washington and just not really fitting in there, or not really feeling the vibe and wanting to leave, which I think is absolutely fair. And as you said, you learned that epidemiology wasn't for you. Some people love being behind desk. And nothing's against that. Like we need that. And then they also like field epidemiologist was a whole different thing. But yeah, what was the huge desire to want to pursue a master's of public health? Like, did you ever have a thought in your mind, like I've done my MBA, I have like some of this health knowledge from my undergrad, I can just like go into the workforce?
Yeah, I feel like I could have now, like looking back, like I could have done it that way. I feel like I've like never had a job yet that required an MPH. And so I feel like I could have just done that and like saved myself a ton of money. But at the time though, I was still obviously mixing a skill set of like program planning, evaluation, grant writing, just critical thinking research. So obviously I think I've been successful at my jobs because I have that knowledge, and now obviously the experience that I've gained from having that knowledge. So I think it would have been harder for me professionally and my success in my professionally without that education. So yeah.
Well, thank you for sharing that. So you switched your concentration at the MPH to behavioral health and community health science. Was that correct?
Behavioral and community health science. Yeah.
Okay. And what was the thought process for switching from epi to this a little more in depth, I guess?
Yeah. Again, it was just because I felt like I could work closer with my community with that option. I liked the aspect of program planning and management. I like organizing, and I like the process that goes into it, which is weird. Like I don't really care about the program I'm working on. I like the process of it. And so I liked that BCHS allowed me to really see my impact in the community. So, like I work, I see every day that the clients that we work with, I know that, we put out, X amount, million pounds of food a year, I see that impact more, I guess, that I'm having and helping my community in that sense. So that's what was attractive to me, switching to that concentration.
Yeah, I think that makes a lot of sense, especially if you're someone who would like to see your work like actually playing out in the community and people's lives, like day to day. So So I think that makes a lot of sense. And then you said that you were an auxiliary. I don't know why I can't say that word. Auxiliary assistant.
Yeah, ancillary assistant. Yeah, so yeah.
Assistant at
Yeah.
Butler Memorial Hospital. So tell me about how do you get that, and then what do you do in it?
Yeah, so I was waitressing through my MBA, and I continued waitressing my first semester through George Washington. I was actually leaving Pennsylvania Tuesday mornings and then coming home Tuesday mornings or Thursday mornings. So I was in DC like not even 3 days a week. And then I would work Thursday night, Friday, Saturday, Sunday, Monday as a waitress, and then leave to go back to DC on Tuesdays. I was funny. I was just looking for a second job, just to like get more money. And I stumbled across that position at the ancillary assistant at Butler Memorial Hospital. And it was a casual position, which worked well for me because I was in school. The pay rate was actually not too bad. And so I applied. It was like the longest hiring process though. Like I applied, it was 3 months later when they got hold of me. I forgot I even applied for the job. So I went there and I met with my supervisor. He was my supervisor there, and he of course he was super interested because I was going for public health, and I worked in the physical therapy department. So it was all rehab. So they had physical therapy, occupational, and speech. And he was interested because I was doing my MPH. So we had an interview that was essentially just us talking just about stuff. And so I started working there. It was supposed to be only like 1 weekend a month, but I actually ended up working and covering more as needed because, like I said, the money was good and it was an easy job. I could do my homework while I was there. So I actually wrote almost my entire thesis at that job. So that fall after I got the job, our full-time worker, the full-time employee there who did my position during the week, she went on maternity leave. And so I covered most of her shifts. And so I was able to get a lot of writing done whenever I wasn't in class and was there working. So, and it was like encouraged when I had my supervisor, and I actually talked about it during the interview. He's like, bring your homework here, do whatever, as long as you get the stuff done, I don't care. And so it wasn't a very stressful job. So it was nice to be able to do other things during that. I also transitioned out of the place I was waitressing in actually, and because I ended up being a shift manager at another restaurant. So I was started my shift managing job, and then that job both joined January 2014. So yeah, it was a nice balance because I could, fit in my job at the hospital around my waitressing job is where I wasn't just my shift manager job as well at the restaurant.
Okay. Yeah, that makes a lot of sense. And that's awesome that you had a manager that wasn't a micromanager and allowed you the flexibility to really like, okay, if you've done what you got to do and you still have time and you do nothing, you can work on your thesis or just homework or whatever the case might be. I think that's important to have as a student. I feel like, especially as you said, you're working another job and doing that and going to school. So shout out to that manager. That's for sure.
Yeah, he was super great. Yeah, it was nice. I was like, I can get paid to just sit here and do this. So it was answer the phone. Like, yeah.
Awesome. Were there any other takeaways from your MPH that you wanted to share about?
I think, again, just having that experience that I had too in the undergrad helped me because I saw also the community impact that the organization that I was with was making. And so I think that also kind of helped me make that decision to switch to community health after getting those EPI classes in. Because you can't get a lot of EPI experience without EPI, without having any EPI. So I think that, internships are important to kind of get your feet wet, like I mentioned before.
When you finished your your master, your MBA, and did you have any time between your MBA and going to your MPH, or was it like straight from MBA, I guess a little break and then MPH?
Pretty much this exact right after. I think I finished it was right before my birthday, actually. I think it was like July 7th of 2013 that I finished my MBA, and I started August is when I started my MPH at George Washington. So just a usual, like a short summer break that I had between. So, and that's kind of how I planned it. Like, since I doubled up in the classes, if I didn't, it would have taken me longer, but I was able to narrow that down.
Okay, and then looking back on that now from where you are right now, is that something you would suggest that other people do as well, or what are the considerations there?
Like not take time off or,
Mhm.
oh, it just depends on who you are as a person, honestly. I'm not good with idle time. And so for me, it was good for me. It was good for me, but other people who get really stressed out, it probably won't be a good option for them. So I know that's like kind of a non-answer, but I just feel like, yeah, you need to know who you are as a person. Like I said, my husband and I were just talking about it the other day about me with idle time is like the worst. So hence the reason I worked like 2 jobs forever. uh, so but yeah, so for me it worked out well. I was happy with that too because it kept me in school mode. I feel like for me personally it'd be harder to go back after more of a time off.
Fair enough.
Mm-hmm.
Definitely have heard that before, and I think as the advice in knowing yourself and knowing what is good for you is great advice. A lot of people try to look to other people and see what they're doing, but they're like not reflecting on, okay, would this suit me and my personality and my stress tolerance and all of that kind of stuff. So I appreciate that.
Mm-hmm.
And then before we move on to your jobs after you graduated, what are some benefits of having your MBA MPH combination in those 2 master degrees?
I think I kind of mentioned it before, but I like that I have the business perspective and that it kind of helps me look at the organization as a whole. Even like when like you think of just departments that are like administrative, like human resources or like accounting and things like that, it kind of makes me look at, their importance in my role as well. And so I think having that business side, I've managed a budget like in a previous role. And so really just being able to look at the numbers that way and be efficient, make sure I'm using my budget efficiently has helped too. Again, just too with the employee retention focus, I think was great because as someone who's worked a lot with partner organizations, it's kind of helped me find ways to approach different organizations differently depending on how they are, to either retain them as partners or grow their programs or recruit them, things like that. I think that was just like, beneficial for me, just seeing it outside the programs that are actually just being offered, because there's so much more to all of our organizations than just what we do. And some of that's not like as, the sexy stuff, like, no one, is thinking about, the person who's doing our payroll and all of those kind of things, but being able to step back and see how all the pieces fit together.
Yeah, I absolutely agree with that. I work with a lot of nonprofits, especially grassroots nonprofits, and those auxiliary things are just so foreign to them. It's like a lot of people start nonprofits because they just want to help the community do this thing that they see a need around, but they don't have that business acumen. And I think that does spill over into a lot of public health students as well. In not having that business acumen as well. So I appreciate you sharing that. And I do feel like public health schools have to do a better job of that. Because even in my concentration of health management and policy, we dealt with like finances and stuff, but it was all healthcare finances, which was I was like, I don't want to work in a health system kind of thing. Yeah, but it was fascinating in that sense, just to learn like broad concepts and topics. But yeah, thank you for the advice. Okay. So you graduated from your MPH, and then you went on to become a SNAP outreach coordinator at for the Greater Pittsburgh Community Food Bank. So how do you come across this?
So I actually had a job for a couple months before I got that job. So I ended up at the food bank because I got a job at a health system in Pittsburgh, and I never put it on my resume because I was there so short. But I had a supervisor who was like had no work-life boundaries. Like she would call, luckily I was just like the lower level employee, but she would call like the person that I was going to take her position one day at like 11 o'clock at night and be like, hey, I need you to run this report for Monday tomorrow. And I was like, and then like the girl, the person right above me, she'd be like, oh yeah, you could have my position one day. And I'm like, I don't want that. I'm that. I like work. I'm like I said, I'm work. I don't do it, but like I have boundaries. Like I work a lot, but I have my boundaries too. And so I'm like, no. Um, and so I was like, I need to get out of here. And so I was looking, literally just job searching again, because I was like, oh my gosh, I can't believe I'm job searching again. It took me almost a year after my MPH to get a job, and I'm job searching again. And fortunately, I found the job at the food bank, and I applied to it because it appealed to me, because it was actually working in my neighboring county. That is the county that I went to undergrad in. So it brought me close to the community, which I wanted. And it was close to home, which was nice too, because I was driving an hour to Pittsburgh every day, which after I quit equaled 2 weeks of my life that I got back, just like getting rid of the commute. And so I had 2 interviews. They went really well. I liked the staff I met. I liked the environment that they had, the culture. And so yeah, so luckily I got the job. And it helped that I was local, because they really wanted someone local to be working in that community, because it was a rural community. It was hard to break into, especially if you're like from the city. And so at the job, I did outreach for SNAP, Supplemental Nutrition Assistance Program, or CalFresh if you're in California. And yeah, so it was in a rural county where I went to undergrad in, right beside my home county. And I got to network with other organizations whose clients could benefit from SNAP. I provided SNAP application assistance, as well as for Medicaid as well. And then the second year was really fun. I actually got to be a preceptor for the dietetic program at my undergraduate university. So all the dietetics interns did 2-week community rotations with me, where I like showed them around the community and talked to them about how food insecurity could actually impact their work as dietitians in the future, especially in the hospital setting. And yeah, it was really great. I loved all the interns, and it was just nice to have that role. So yeah, and it was nice to work in that community. It was, again, like I said, rural communities are interesting. Pittsburgh Food Bank covers 11 counties in southwestern Pennsylvania. So it's not just Pittsburgh, it's the greater Pittsburgh. So it's all pretty much of southwest Pennsylvania, except for one county, which has their own. In the rural counties, Pittsburgh's not like a great, sometimes always a positive thing. They think, it's different culture, different mindset than the rural areas. So it was very interesting when I would go places and they would be like, oh, you're from Pittsburgh? And I'd be like, oh, no, I'm just from Armstrong County. And they'd be like, oh, and like I was one of them. And so it kind of helped me break into the communities a little bit better. People talked to me more because I was just like a local girl. But it was also interesting because I worked with clients, and it kind of made me more aware of things like that. Like one day I was wearing a dress that I got at Walmart. Like it was a Walmart dress. It wasn't anything fancy. But a client was like, you look like you're rich. And I was like, I'm not. And so I'm literally wearing a dress from Walmart, like, and I work in a nonprofit. But like it really made me consciously aware of how professionals like us, when we work with clients, how we look. And so I ended up I dressed down then during my work, because I didn't want my attire to be a barrier for someone to, ask for assistance. So, but yeah, just a interesting learning at note.
Yeah. And I love that. I think there's also the insights of you going to the health system and figuring out that was not
Yeah.
at least with that manager, that was not the way that you wanted to go.
Yeah.
You probably have a lot of gray hairs if you did that.
Yes.
That sounds very, very stressful.
Yeah.
But I'm glad that you're able to get to the food bank. Okay, so I'm gonna ask an ignorant question here.
No, it's
just so people might understand. Maybe you have a good answer for this, maybe not. So what is the difference between a food pantry and a food bank?
So when you think of a food pantry, think of the small things, like at a church, at maybe a college community center, or those local things. The food bank is the big organization that provides the food to those little organizations. I always said, like, at the food bank, it was like we were like Sam's Club, because I always said that because we got discounted. We get, food from the government. So our funding comes either from government donations, private donations, but also from like foundations and grants and things like that. So we get a better price on things though when we get them from the government. So that's why I said we were like Sam's Club, like the bulk food. And then we can give those savings to our partners, which are our pantries. So
Okay, awesome.
yeah,
Thank you.
yeah.
Thank you.
Mhm.
Thank you for indulging me there. And you also said that you were able to work with dietetics, nutrition dietetics, interns as their preceptor. What did you learn as being their preceptor in this position?
It made me just think about how closely food insecurity impacts so many aspects of our lives. Like I knew that I worked at a food bank, I worked with clients, but when I started working with them, like we would talk about things. I would think about, they go see Jim who just had a heart attack and is in bed, and they go over to Jim and they're like, well, Jim, you can't eat processed foods anymore. You can't eat this or you can't eat that. And, you should only get fresh fruits and vegetables, and you should only, purchase fresh meat. And it's great. And it's a great concept to think about, but it's not feasible for many people. And so when you're also just talking to this person who just had a traumatic health experience, that now they have to only eat food that they can't really even afford, that's just a huge barrier that people have to overcome. And so again, it's one of those things that but you don't really think about it until you start talking with people who are going to be in that field. And that's kind of when I was with my interns talking about that. Also just the aspect of food preparation. Your client might not have a stove. You might have to talk to them about how they can only cook with a microwave. They might not have a can opener, like great refrigeration. There's all these other barriers that they're facing. And so whenever, professionals are working with their clients, they need to have, address those. And sometimes professional programs don't talk about that.
Yeah, absolutely. And I think to add to that, definitely like the cultural competency of like the foods,
yes,
and having culturally relevant foods is hugely important as well.
Yeah, that's a whole other, which at the food bank level too is difficult for us to be able to make sure that we have foods that are culturally culturally appropriate for different folks. And so but it's also a challenge because that's also those for us is because supply, it's harder for us to be able to be that specific. Like we have a lot of clients who want gluten-free bread, but it's so much, it's more expensive and harder just for us to get. We would have to directly purchase that. You're not getting commodities like things like that. And so it's definitely a hard route to follow. But again, from that big picture view is like you can get more of other things. And so, if I can get 50 of one thing, only 20 of another, it's that hard decision that it comes down to. So it's
yeah, I could imagine a lot of hard decisions around that, and like people wanting specific needs and taking into consideration all those other things. And then I think it's very important that you pointed out the barriers part, and it comes to mind, like as you were saying, that exactly what you're saying about like people mightn't have a stove or they might have like a microwave at home, and really thinking about all those barriers. And I think another huge barrier that you did mention earlier is like how we dress and show up to different community, and how they view us. Like, are we approachable? Are they going to be feeling comfortable to tell us about their issues and their concerns and those kinds of things? And I think that's also one thing that I think is kind of under not spoken about enough in public.
Definitely.
On that side. Okay. So you got a promotion or a shift into a child nutrition outreach coordinator. So was it a promotion or a shift? And then what did this change entail?
So it was a shift in positions, but it did allow me actually to expand my role. So I went from working with one county with SNAP to working in 4 counties for child nutrition. So shift, but with more responsibility, which was nice. So with my child nutrition work, I had two primary programs that I worked on. So I worked on the summer food service program and the school breakfast program primarily. But I also dabbled in the backpack programs, after school meals, and things like that too, school pantries. And so kind of in my last role, I worked a lot with partners, which was great. I worked with schools and community organizations to expand their meal program. So for example, for school breakfast, this might be by trying to increase their school breakfast participation. So we would maybe try to implement new marketing techniques. We might implement a new breakfast model. So there's different breakfast models, especially at the elementary level. We did elementary and high school focus. So we focused on both. So it could be like at the elementary, maybe instead of having kids eat at the cafeteria, they eat breakfast in the classroom. So it's more accessible. Maybe at the high school, it's like a or it's a second chance. So a lot of kids, especially high school kids, they're not hungry in the morning when they get to school, but they are in second period. So having breakfast available longer to address those needs. In summer food, it was adding meal sites and locations and improving marketing and activity at site. And so I loved what I did and I was good at it. I really loved my partners. And it was like really sad when I left Pennsylvania and left that job because I love my partners so much. And they were so dedicated to their program and they wanted to expand their programs. And they like said yes to everything, everything. They were so great. And so I definitely, I loved it.
Well, I'm glad you loved it and that you were able to thrive in more responsibility and more work. And I think it's very fascinating that you say that like there are different models for breakfast or food in schools, and that's something that I didn't even think about. And I'm working on a food systems change, so I'm definitely going to look more into that as well to learn more about that. So thank you for sharing that.
Yeah.
Okay, and then you were the vice president board of directors for the Richard G. Snyder YMCA campus. So how would you get into this, and then what are the kind of responsibilities for this?
Yeah, so I applied for a job at my local Y. So that was actually my local YMCA. I applied for a job that I wasn't qualified for, but I applied for it anyway. But when I applied for it, the board of directors liked my application. And so I got a call one day from the board, one of the guys on the board at the time, and he's actually was on the school board too. And I was like, oh my gosh, why is he calling me? And so yeah, I got a call and they were like, whenever we didn't offer you the position. I'm like, yeah, I know. I was like, yeah, I know I wasn't qualified for it. And they're like, but we were really impressed by your resume and your cover letter. Like, so we want to talk about you about being on the board. And I was like, oh. So I got on the board. And at first I was on two different committees for responsibilities. I did special events, which obviously is self-explanatory. I was planning different things for fundraising, and then marketing committee as well. So we did fundraisers, and the marketing committee, we, worked on ways to improve the Y's outreach and that in the community. And then of course, just as a general board, we did a lot of the stuff that, all boards do, fundraise, budgeting, feedback on programs, that kind of thing. And then I was on the board for maybe a year-ish, year and a half. And I got a call from one of my fellow board members, and they're like, hey, we want to meet with you about being vice president. And again, I was like, very surprised, because the executive committee was looking for a new. So what would happen is it was by terms, and so the current president was actually, his term was ending, and then the VP was stepping up to be the president. So they were filling the former VP's role, and the executive committee already had met and discussed that I'd be a good fit. I was like, oh wow. And it was actually interesting because I was the youngest person ever elected to the role, and then also the first female to hold the role. So pretty cool. So in this position was just a lot more meetings and working more, getting more into the budget. We rewrote the bylaws during that time. So doing more of the back end work that the board just kind of votes on, because the board, has a say in the budget, but someone else, another committee does that and it just goes to the board. So we did more of the deep dive work. And I also led the Major Gifts campaign, which was part of the annual campaign section. So I worked on educating the board on how to ask for a major gift and offered support and connections for those who were struggling. And yeah, so it was kind of nice because as part of the executive committee, I was more in tune to like staff issues and other challenges that the Y could have been facing, or the good. And meanwhile, like I still sometimes you only hear about the good stuff other places. And then during my time as vice president, the CEO actually resigned. He was decided to move out of state to be closer to family, and I co-chaired the CEO search committee with the board member that I was really close with at the time, and that was really interesting. And it was fun to see that whole process come through as well. So if I hadn't moved, I would have been president of the board right now, but I left. And so my seat was filled by someone very, very worthy.
That's awesome. And I just want to make sure that people do not miss that you applied to the Y for a job position that you were underqualified for, and that led to you in all of this experience that we spoke about for the last couple of minutes. And I think that is something that people undervalue, that even though you might get this specific position or whatever you're looking for, it still might open up the doors to other opportunities. And it sounded like those opportunities that you were able to get were very invaluable to just learning. And it's like not typical things a lot of people get to deal with, especially when we are younger professionals. So that's really awesome. So I'm glad that they were able to put you on and that you were able to do all that great stuff.
Yeah, I guess it was like failing up in a way.
Yeah, absolutely. So when you started your consulting business, you were in San Diego.
I did start my consulting. So I've had my consulting business since January 2016.
Okay.
So I actually started it in Hawaii.
Okay, hold on. Let me say the introduction for the consultant, and then we can get into these details. So you're the owner at Tabitha Reefer Consulting, where they specialize in grant writing, writing services, program evaluation, program coordination, professional workshops, and curriculum development. So you said that this started in 2016 in Hawaii. I'm guessing that you were not doing all of these different things when you started. So tell me about the start and the thought process for starting.
Like a lot of consultants, I've spoken to several consultants, and everyone is like, I just kind of fell into it. And I feel like that was my case. And so after I graduated my MPH, I knew I was moving to Hawaii because my husband was stationed there. He was actually deployed. We got married in February, and he was deployed in May, right after I graduated. And so I was a little bit of time where I was like in this weird in between, but we had an apartment there, so I could move out. So I was applying to jobs. Hawaii is a hard place to get a job if you're not a local. I had one job interview out of all my applications, and that was what the woman told me, that you're not going to get hired because you're not a local, but I just wanted to talk to you anyway. And I'm like, okay, thanks. but she did say that, she's like, since you're not a local, you're going to have a really tough time finding a job. And I was like, that's nice. Through all this, I was still in contact with my internship supervisor. So I did an internship at the Pennsylvania Department of Health during my MPH. Was still close to my advisor, but of course, when I graduated, the internship ended. So, but we were still in contact, and it was like the end of December, sometime in December, we were talking. He was like, would you be interested in coming back as a consultant? And I was like, sure, I'm not doing anything. Like, awesome. Like, that'll give me some money. So starting in January, then I created my first statement of work and started consulting, and did that at the Department of Health for about a little over a year and a half. It actually stopped because Department of Health ended these type of contracts. So they just kind of stopped doing that. So it was what it was. But it was kind of nice because I was consulting with the program I had previously interned with. So I was working with stakeholders that worked with the program called the Get Smart program. And then it transitioned to Be Antibiotics Aware, but it's about antibiotic stewardship, and it was funded through the CDC at the time. A lot of it was from Hawaii, was managing in other interns and volunteers. to do the work that we were doing, but also being in contact with CDC and other stakeholders that we were working with at universities, particularly at Pitt and Penn State, around their programs that they were doing. So we were working with the School of Pharmacy to do a rotation in antibiotic stewardship and at Pitt. And then at Penn State, the one department was working with like health communication, was doing research about watchful waiting. So we were working with them as well. And then on the side for them, also I was helping scheduling their monthly journal clubs. So they had 2 journal clubs a month, different names. They've called one the Journal Club and one the Brown Bag Series, but it was like the same exact thing. So I was helping them recruit the speakers for that, which was fun because I got to talk to a lot of cool people from like the FDA, EPA, CDC, NIH, all kinds. So, and it was really fun because I actually got to talk to Dr. Ali Khan, who wrote The Last Pandemic. So that was cool because he was one of the speakers the one time as well. So, but yeah, so I did that role for about a year and a half. And then after they stopped the contracting through the DOH, I actually stepped into a role for a private advisory group, which this actually was with the same stakeholders from this program at the Department of Health. They just decided to make a group that was unaffiliated with the health department. And so I stepped into a coordinator role through them. And so again, still working in collaboration with universities and healthcare systems, as well as county health departments that we had partners with. So we helped we held some workshops about antibiotic stewardship in long-term care facilities. We did education for child care centers around proper hand hygiene for kids and how to teach their kids in their centers how to properly wash their hands and incorporate it, that kind of stuff.
They were getting training before the pandemic started.
Yes. Yeah, starting them early.
Yeah, I don't know. I'm not gonna go down that path. But I'm glad that you're able to do that work, and that's awesome that you were able to work with like the same group of people in a different capacity, but still doing a lot of the same coordination work. So how long were you consulting from Hawaii before moving to San Diego?
So I was in only Hawaii for 3 more months after that. And then I moved back to Pennsylvania for about 4 years. That was when I was at the Pittsburgh Food Bank. So I was still consulting on the side. Yeah. And then I actually was still consulting for that advisory group until about 2 months ago. And the only reason that it stopped is actually we have integrated our advisory group into an organization based in the Netherlands. And so now I am in contact with that group. They're called AMR Insights. And so they're based in the Netherlands, but they work with ambassadors throughout the world, and they do antimicrobial resistance, stewardship education, and research. And so yeah, it made more sense for us to integrate with them to make our program more sustainable and then also be able to spread our programs out. So
yeah,
that's still very new, and the transition is still happening. But it's exciting.
Yeah, that is exciting, and that is quite fascinating. Hopefully you don't have to do a lot of calls with them being on the West Coast.
Yeah, it's 7 a.m. usually at my time, and then they do like a 5 p.m. their time. So yeah, and our stakeholders in PA are still involved, so it's like 10 a.m. for them. So it's very interesting to coordinate.
I can only imagine.
Yeah.
Okay, so tell me about the progression of adding on more services with Tabitha Reefer Consulting. How did that go? What was that process like?
So I was kind of always doing this work with my group consulting work now, was like a lot of program management, stakeholder collaboration. I was doing, newsletters, helping draft journal articles, abstract submissions, all that thing. So all those kind of writing services, I was evaluating our programs, kind of all from that work there. And then I really enjoy I think I've already said, like, it doesn't really matter the program. I like the process. And so that's why I've always liked this program management aspect. I like working with stakeholders. I like running programs, building relationships, setting goals, and all of that stuff, seeing how the goals are. And then also, the grant writing and the reporting too. just to see how we did. And then I have this second arm of my business that started in 2019. And so weirdly, it's like this weird. So so my second arm of my business is teaching, and I'm like working through what I'm calling this still, because I'm not in love with my name right now, but I'm just sticking with it. So it's like work-life harmony workshops. And so I switched it from balance because I know balance puts a weird taste in people's mouths, but I felt like harmony was a good compromise for right now, because it was kind of, harmony is based on you, and that's my whole thing I talk about. So I started teaching the classes in 2019 through a community college's workforce development in Pennsylvania. It was kind of funny because I attended a class of theirs in the spring, and it was on goal setting. And I was sitting there and I was like, I could teach a class like this. This is easy. I could teach a class. I know this stuff. We talked about SMART goals, we talked about this and that. And so I went up to the people afterwards and I was like, hey, I could teach you a class on these topics. And I was like, here's my card. Like, I had my like regular business card, but I was like, here's my email, reach out to me, if you're interested. And they got a hold of me. And I was like, oh, they actually want me to do this. And so I did a class, and it was like an overview class. We talked about time management, mindfulness, sleep, goal creation, like this it was just like a big mesh of like an overview. And it went really well, and I liked it. And I like doing the classes because, like I told you, like I work a lot, and I used to not have good boundaries, but I do now. And I like talking about boundaries but still being productive, because I think that's important, and that I like having boundaries, but I also like being productive. So I kind of like to talk about how I've like found systems that work for me to be able to be productive, but still feel like I have plenty of time to like hang out and chill. And so from that, I've gotten other contracts, and I'm currently in a webinar block right now. So working with another, it's an adult education school, as well as Penn State work as well. Penn State, one of their branch campuses. And so I've been doing an 8-seminar series, and I have 2 left. So yeah. And so I'm now expanding and offering classes, hopefully to corporations out here in San Diego. I'm in the process of doing my onboarding for an adult school out here in San Diego to start teaching classes there. So it'd be for community members, but also teaching classes for their staff on these topics, because they've had a high need for people wanting these topics, but they haven't had someone to teach them yet. And then when I came, they're like, oh, great, they're even asking about these things. I kind of just, again, weird stumbling upon things in life. Like, I feel like my life's just a stumble.
Yeah, and that is absolutely fine. So just to send to me here, what year did you move to San Diego?
August 2020.
Okay.
Yeah.
Thank you for that.
Mm-hmm.
So
yeah.
So I wanted to ask more about the work-life harmony that you're talking about, because earlier you said that you really are a workaholic. You love to work. You can't do nothing, as your husband said. So I want to learn more about work-life harmony and what strategies you have used or structures or systems, as you said, to better that work-life harmony, as you said.
Yeah. My biggest thing is I'm very OCD about my calendar, and like, it's so weird, but I feel like everything goes back to my calendar. I'm a big block scheduler, and I do it for all of my life, like work and my personal life. And so for me, I found that I need to have things written down in a plan to do things, like if I have an empty air, I can't function. I like just pace around. It's like I'm a lost puppy. I'm like, what am I supposed to be doing right now? Am I supposed to be doing something? And so for me, setting my boundaries with work is like I have my work time on my calendar, and when I'm not at work, I don't check my email. I don't get notifications. Like I use quiet for Gmail. That way all of my notifications shut off at a certain time. That way I don't have to do that myself every day. Just, I set my time where my emails can come through, and if not, I don't get notified about it. And I do it for my personal ones too. That way at night, I don't just get notifications. Same with like my consulting work. I've I have office hours essentially. So that was something I think I struggled with the most when I came back from Hawaii and I was in Pennsylvania, and consulting is like, I'd be checking my email at like 9 o'clock at night, and like, that's not normal. Like, you shouldn't do that. And so I think it's harder when you have a business to turn it off. And so for me, like putting work office hours for my business on my calendar really helped me again set those boundaries, because I could visually see it. I visually saw that, of course I worked Monday through Friday at my job, especially back home. And like, I was like, okay, Tuesdays and Thursdays from 5 to 7 or whatever, like I'm going to do business stuff, and that's time. And maybe on Saturdays for a few hours, but like, that's when I'm doing it. And I'm not going to be checking my email. My email's going to turn off after this time. People will know when I'm available then too. Like if I needed to send an email out with like, I can say like, I'll get back to you on Thursday, or I'll get back to you at this time. That way, at least people also has expectations of when they would hear from me. So then those boundaries then went outward as well, if that kind of makes sense. That way they knew if I didn't respond, being vocal about when you're going to work, when you are going to be answering people. Because I think it is also courteous. I mean, if I send an email, I kind of want to know when someone's going to reply, especially when you know that they don't have really their job, not a traditional job. If I send you an email for your day job, I know you're probably going to get back to me the next day, maybe, but I have that kind of expectation. But for a side job, it's like, what's going to happen? And so that was kind of, I think, the first thing I did to kind of do that for me. And that's kind of what I talk about too, is those setting boundaries of the email, things like that. I think the next thing I cleaned up was my sleep, because sleep is so important. And after I read Why We Sleep by Dr. Matthew Walker, literally scared me into submission. I was never like a bad sleeper, but I didn't have habits in my sleep as well as I should have. So I think that's like my favorite thing to talk about when I teach work-life harmony classes, because seems like a weird topic to talk about, but it's so important. And I like totally use the scare tactics on people too when I'm talking about it, because I feel like if it scared me, it's going to scare other people. But like getting, very strict with turning off my phone at a certain time, making sure, I have time to relax, that I'm not watching TV too late, that I'm, my bedroom's cool, like blackout curtains, things like that, because that has helped me, meditate more, read more, because I, turning off those things, but also just be more productive because I am properly sleep properly. I'm trying to think what else has been big for me is scheduling, again, just like things for myself. And so again, if I put something on my calendar, I'm probably going to do it. I'm not going to flake out. So, if I'm going to go hiking with a friend, I make sure I put it on the calendar ahead of time. Or if it's just something that I want to do, like I want to meditate for 30 minutes a day, like I schedule it on my calendar. I schedule my workouts every single day. That way I know, like, okay, when I get off work on Monday, I'm going to come home and I'm going to work out, or I'm going to work out before I go to work. So I constantly talk in my classes about finding time for things that you want to do and scheduling it, because everyone has a list of things they want to do, but then they'll say that they can't do it because they're too busy. I feel like sometimes that's the case, but it's not always the case. And I feel like we waste a lot of time in our lives, and especially because I work with a lot of professionals, and I always talk about it too from a point of privilege, that there's definitely some people who don't have time. And that's 100% true and valid and happening. And we definitely need to get better on that. But like I said, I'm privileged and usually talking with professionals. So I know that they actually do have the time. So luckily. And so, you know, how much are they on their phone? You know, I talk about tracking how much, you know, time. I talk about the ability to block apps on your phone using like apps like, I use Quality Time because I have an Android. Moments, I think, is the one for iPhones, which is great and I do that every day. So every night my phone takes off blocks all social media apps, things like that. I only have like essentials on there. So I have like Kindle or my language app or things like that. Sundays from 9 a.m. on, all of those apps are that way I can like deplug from social media for a day. And it's like about that automation, kind of like when I said quiet for Gmail too, of automatic things that I do to make sure that I'm in order. Like I don't have to go physically block my apps, or I don't have to pretend like physically, mentally have to think about doing that. It just happens, and I don't have to do any extra steps. It just happens because if it's relying on you, it's probably not going to happen. So a lot of automation in my life. Yeah.
Thank you for sharing all of that. I think all of those are like really great points for people in general, students. Right. I think it's important for like productivity as well as like just work-life balance, not burning out, making sure that you are being accountable for your time and doing the things that you want to do in the time, and really going through and seeing, okay, I'm on social media for 3 hours a day and I want to do this other thing. So let me get this app so I can block it, and being intentional. And I think it's so important to have those types of systems and reduce the amount of friction that's needed to do things, because humans, we're definitely infallible, we're very emotional, and I think creating those systems takes that out, that guessing game or like emotions out of it, and it's just, okay, this is going to happen like this. And it definitely might take a while for you to build in these habits, but I think they're hugely important habits that can increase a lot of things and improve a lot of things in your life. So I'm glad that you're doing that. What are some things that you've learned from having this consulting business since 2016?
I know for me, it's just been that I like working for myself, or like just even be able to have this option to make my own schedule to be when I'm most productive, which is super important. And just like when I want to work, you know, like, and so I would like one day that I can do this full time. This would be my main thing. I don't want to have to apply to a job ever again. Like, hate the job process. And so I told my husband like a couple months or so ago, I was just like, I don't want to apply to a job ever again. And he's like, and so hopefully that happens. But also just, again, I think from having my business, I've been able to learn how to set boundaries better, because I've been, again, forced to have to do that, versus if I only worked my 9 to 5 and didn't really have anything else, I wouldn't have felt the urgency as much to clean up other areas of my life. So just personally for that.
Okay, awesome. Well, thank you for sharing that. And I definitely believe that you will be able to make this your full-time job. You got to believe as well, and it will definitely happen. So I appreciate you sharing about that. If somebody wanted to contact you for business inquiries, where's the best place for them to do that?
My professional email is Tabitha Reefer Consulting @gmail.com. So just my first and last name with consulting, all one word, lowercase, and so people can reach out to chat. I know sometimes, or if people can, or like I've talked to just other consultants before too, who just kind of want to talk shop. So if anyone else is a consultant that just wants to chat, definitely reach out too.
Okay, awesome. I'll be sure to put that in the show notes as well. So moving on, you currently work for the Jacobs and Cushman San Diego Food Bank, currently part-time, but I believe when you started, you were full-time.
Yes.
Okay, so you started full-time as a project coordinator. So how did you come across this, and then what did you do?
whenever we decided to move out here to San Diego for my husband to go to grad school, job searching again, and lots of job searching. I applied to like 65 jobs, very exhausting. I got a call from the food bank after an application and as a project coordinator, and I was happy to stay within the food bank. Like, I'm comfortable at food banks. I know food banks and the systems, and that was that. And so I had a screening with the director of programs and then a interview with my current supervisor, and definitely liked the organization, like the organization and its mission. The project coordinator, because it was a volunteer project coordinator, it wasn't the best fit for me, and my supervisor didn't know that at the time. And I came with a lot of experience with programs, and so I was asked, offered the job, and I did obviously accept it. So my role at that was supervising volunteers, working with groups to schedule volunteer. Yeah, so that was primarily what I was doing. Yeah, really wasn't overly passionate about that position. It was, it was a lot of time on my feet in the warehouse. That was like 100 degrees during the summer. This actually, my first like month in the job, actually wasn't even really doing my job because they actually had to cancel all the volunteer shifts because it was too hot in the warehouse. It's like 110 degrees. So they're like, oh, we can't have volunteers in here. And so fortunately I had a supervisor who advocated and knew that, and there was a better option for me out there. And so in May, I should say, I kind of went to her, and I was like, I'm really burnt out from this role. Like, I told her, I'm like, I can't continue working right now, like full time. Like I can't, like I've had too much burnout from this last month or for this last year. And so luckily then she spoke with her superiors and HR, and they were able to offer me a new role in a part-time capacity. So it was nice because it was a new role that much better fit as a programs coordinator, working with programs, more my jam, but also giving me that part-time that I wanted to de-stress a little, but also concentrate on my business, because that was another factor, is that after the year of not really being happy in that role, I kind of was like, okay, what do I want to do? And that's when I wanted to really take my consulting seriously, because it was always there and I was always doing it, but it was always that side hustle that I just tried to fit in elsewhere. And so I was like, I want to be able to dedicate time to be able to do that. And I just can't up and quit a job to do that right now. But I figured if I've been able to do my business part-time or, on the side while working full-time, and then back home, I was also working another job too at that hospital job still, I can, still do it now in a part-time role with that more time to do that. So that's kind of how I ended up there. We have, staff's great. Everyone's very mission driven. Food banks always do a great job of having employees that are very driven by the mission. Yeah.
Okay, that's awesome, and that's great that your boss and the organization as a whole was receptive to you not wanting to burn out and like shifting you into this role, as well as making you part-time. And as well, that just gives you the flexibility to do more with your consulting business as well, which I think is huge. And I think like a lot of people don't even think about maybe asking if they can go part-time with their jobs while they're trying to build up this consulting company on the side. And I think that's hugely valuable. So how do you balance both your consulting and this part-time role?
So I'm lucky that I kind of make my own schedule, but like I keep a consistent schedule there. So I do flex my days if I need to in hours. So I'm flexible at the food bank, but I typically try to work Monday, Wednesdays, and Fridays there. So I do like typically 2 full days and a half day in there in some, some pattern. It's not always like half day Fridays. Sometimes it's Mondays. It's whatever I have going on that week. And then I do 3 days with my business. So I'm typically working 6 days a week. I work Tuesday and Thursdays is when I do the bulk of my consulting. And then Saturdays, I do some consulting, typically like a half day, not a full day those days as well. So it's, again, seems like a lot, but again, for like, and that's why I like the harmony thing is like, for me, I like working. And so for me, it's good to be doing that. My husband's, like I said, I've said, like, he's in grad school. So like, he's studying anyway. So like, it gives me something productive to do while he's busy anyway, and I'm not just bothering him with my idle time. But yeah, so it's worked out nice. Like even when I work half day at the food bank, I typically don't come home and work on my business unless I'm taking another day off for something. But if I'm actually dedicating those 2.5 days to that as well, I actually do have that time as like, I have like a Spanish tutor and I get homework. So I'll do like my Spanish homework, or I'll do, a longer workout, or, just something else. So I still try to keep those boundaries in some way. And and if I need to swap a day and I need to work a Tuesday at the food bank instead of a Monday, I just shift my consulting days around. So it's kind of nice in both areas. My work right now is kind of flexible if I need to respond to one need in one job right now.
Okay, yeah, that is awesome, and I'm glad that you have the flexibility to do that work.
Yeah,
and I hope that you continue to thrive and be able to continue to build up the consulting while doing this work on the side as well. And I was going to ask what you said you had a language app, and I was going to ask what language you're learning. And I think Spanish makes sense for San Diego, so
yeah,
it's
really
close to Mexico.
Definitely. Oh yeah, very close.
Okay, so those are the positions that you're currently in. I know that you also have, I think it's a certificate with the American Council of Exercise Fitness as a health coach, and as well as a fitness nutrition specialist. So do you want to talk a little bit about those?
So with those, well, the health coach, I always thought just made sense with public health, especially with health education. I'm really interested in health education, but I felt like so many of health education jobs I've looked at have always required like an RN, which is a whole other frustrating thing of like things MPHs can do, but they want a nurse to do. And so I'm just like, what's the difference? Like I can teach health education as long as I don't have to like, do anything super medically. Like if I'm just educating, I should be able to just educate. And so I got it because of that, but just because of personal interest on health and that. Also just for my consulting businesses too, even though I don't do specific health coaching with it, I've just thought for my workshops, it's also good to have it, the education just from that lens as well, in case I want to, talk about nutrition, or I want to talk about physical activity. I have more experience with that as well. I got the fitness nutrition specialist actually too, personally. I like working out, and I like eating to help my performance as an not competitive but an athlete. And so it was kind of personal for me, just to get that education for my own knowledge. But again, nutrition is really interesting to me, and I think if I would be able to do it all over again, I think that's probably the route I would have taken. I've actually thought about going back for my RDN, but I just can't be committed to the debt. I can't. So yeah. But it's interesting to chat about, and to to talk with others about who are also interested in that as well.
Yeah, absolutely. And I think, like as you're saying, you personally wanted to develop more knowledge around health and nutrition and fitness for yourself, and I think it also plays into both your business and work-life harmony, as well as just understanding maybe some other non-population level public health type of stuff, which is also important to know. And completely feel you're not going back for the RDN.
Yeah.
So before I move you on to the last section of the show, the Furious Five, I wanted to ask, where would you like to see yourself in the future?
I actually hate this question.
You can skip it if you want.
No. I mean, like I mentioned before, I would like to consult full-time one day. Like I like working for myself and having the flexibility. I feel like it's hard with having your own business, because I feel like every day is like it's gonna fail, it's gonna be terrible. And then like one good thing happens and it's like, oh, I'm awesome. And then like 2 seconds later, it's terrible. Like it's this roller coaster of craziness. So I'm hoping like it's gonna work out. And maybe like in the next 2 or 3 years, like maybe I'll be able to do that full time in some capacity. It also is just a weird, like a hard question for me because with my husband still being in school, like I feel like at the age of 31, I would have like had like more roots or something planted, but I just like, I don't know what's going to happen. You know, he next fall he goes to clinical, but then he'll get a job in the year after that. But I don't, yeah, I feel like there's so much, some things, stuff's always changing. And so I just try to go with the flow and try to plan without stressing myself out too much.
Yeah, and I think that that's all important. And
Yeah.
And like as I think we said like earlier, like things you don't have to be set on whatever your goals are. Like your mind is going to change with your experiences and with life and everything. So it's always good to have like some sort of direction, but then things change as we go by. So there's no problem in that. And but I do hope that you are able to get to where you are supposed to be in the future. So,
thank you. One day.
Of course. All right, so moving on to the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say network, definitely networking. And like, if you're struggling to do it, like trying to talk to an advisor about it. Another thing is talking to your advisor if you're like struggling to do those kind of things, because like sometimes people aren't available. And I think that's something for me, since I worked so much during school, I didn't get to do that. And I don't think my advisor and my professors understood why that was the case. And I should have been more upfront about, hey, I'm like working 50 hours a week plus going to school full time. Like I don't have time to do this other stuff as much. And so I just think being honest about like what you're going through, and if you're if you have other commitments, to be upfront about them, because I think professors are great, but they don't also understand because now they're professors and they don't think about what it was like whenever they were students.
Yeah, great advice. Number two, if you're talking to someone wanting to get into your position, I guess both as a part-time program manager and in your owner of your consulting business, what advice would you give them?
So for my nonprofit role is if you're interested in working in nonprofits, like finding a position or a topic area that's really important to you, and making that your fuel, because the wages in a nonprofit will not fuel your fire, but your passion for the community will. So making sure that you actually are in it and want to work for the community, and that's what you want to do. And wanting to see, making sure, that you want to see that impact in your community, knowing that you're going to work with amazing and dedicated people at the nonprofit and with your partners who are super great. And so getting experience in those roles to make sure that that's a good fit for you. So maybe you really like working with older adults. You want to really work with like in dementia and Alzheimer's, go for a nonprofit, get that experience and see if that's really a good fit for you. You can do as many internships as you want. For consulting, again, making connections. Like I said, a lot of my consulting work has just been through connections and word of mouth that way. And so making sure that you're making the connections with the right people who could eventually maybe turn into clients or recommend you to people who could become your clients.
Okay, thank you for that. And number three, what's something you're working on improving in your life right now?
I feel like putting myself out for my business out there. I'm really comfortable working with community partners and things like that, but I haven't had to do that for my personal business. And so I'm just working on like getting out of my comfort zone and like putting my business out in the world, because I never really promoted it. I never promoted it before. And now I'm like actively trying to promote it. So I like hate doing business stuff on social media. Like I absolutely hate it, but like I know like you have to do it, especially right now. And so just trying to work on that. feeling comfortable, but essentially hating every time I post a reel, I just like cringe. I'm like, I hate this. But hopefully, hopefully one day not having to do that. But right now, that's what I'm working on.
Fair enough. Good luck with all that. I actually love seeing your reels, just by the way, because I think they're very different from especially other public health consultants. So I appreciate those.
Oh, thank you.
Number 4, professionally, do you recommend anything?
I read a lot, and I feel like there's 2 books that I feel like I go back to all the time. And I already mentioned the one is Why We Sleep by Dr. Matthew Walker. But the other one is Atomic Habits by James Clear. So I like his newsletter he puts out every week, follow him on Instagram. And so I think habits have been really important for my life. And I talk about a lot about habits in my workshops that I do. And so I just think for me, those are 2 books that have been really great professionally that I've actually bought. And I don't buy books, and I've bought both of those.
Yeah, that says a lot then.
Yeah.
Thank you for recommending those 2. And last but not least, where can people connect with you?
Either LinkedIn or Instagram. Yeah. Either of those are great. So either at Tabby Reefer or on Instagram, and then LinkedIn, it's just under Tabitha Reefer. So luckily I have not a common name, so it's pretty easy to find. But yeah, I'm like connecting and chatting, so anyone can follow.
Awesome. And I'll be sure to link those in the show notes. Everyone can definitely tap in and see all the work that you're doing. But thank you so much for coming on the call today and sharing your public health story. I really enjoyed hearing it and connecting with you once again. And I look forward to connecting more with you and just learning more about the work that you're doing and how I can support that as well.
Thank you.
Yeah, my pleasure. So housekeeping items, everyone. Thank you for listening or watching to this. I greatly appreciate it. Make sure that you subscribe, you like, you leave a review, and you share it with a friend. That would be greatly appreciated. And if you want to support, you can go to buymeacoffee.com/the PH Millennial and support across there. But I will see you all next week.